Hello to everybody, my name is Anton Ficai and on behalf of my colleagues Denisa Ficai, Ecaterina Andronescu, Maria Sonmez, Ovidiu Oprea and Bogdan Vasile, I will present to you the patent multifunctional systems based on magnetite, thioacids and silver or gold nanoparticles used for the targeted diagnosis and treatment of cancer. So, for the beginning, I would like to highlight the actual context. First of all, it is important to mention that cancer is a leading cause of death worldwide, being just surpassed by the cardiovascular diseases. Starting from these statistical data, it is important to find innovative solutions to reduce the mortality induced by cancer. The aim of this presentation is to highlight the advantages of the use of these core shell magnetic nanostructures in cancer treatment. By short, these nanoparticles are injected into the bloodstream and are slowly distributed into the body. But if a proper receptor or a proper external force is applied, such as in our case a magnetic field, these nanoparticles can be accumulated in the desired organ or issue, as schematically presented in this slide, in this short movie. It is important to mention that targeting is important, especially because the anti-tumoral agents are toxic and thus their local regional delivery is important to avoid the systemic toxicity, the undesired negative impact on the healthy tissue and organs. On the other hand, according to our previous patent, RO129724, the delivery rate can be enhanced and, as a consequence of the higher amount of cytostatics released, the anti-tumoral activity is also enhanced, thus personalized therapy can be assured. The development of these smart magnetic targeted drug delivery systems involves several steps as schematically presented in this slide. So, the first step involves the synthesis of magnetic nanoparticles using specific stabilization agents such as, for instance, cysteine. Certainly, a mixture of cysteine and PEG can be considered too. In this way, magnetite nanoparticles stabilized with cysteine will be obtained. Further, these nanoparticles are exposed to silver or gold colloidal solutions, and because of the high affinity of the thiolic groups to silver or gold surfaces, the decoration of these nanostructures will occur, developing core shell structures. Further, these core shell structures can be either decorated with receptors for specific cancer cells. In this way, a specific accumulation will occur as we presented previously, and further can be loaded with anti-tumoral agents. Certainly, the bioaccumulation can be also assured by an external field, and thus the decoration of these structures with receptors is not mandatory. If these nanostructures are used also in imaging, in cancer diagnosis, in this case the presence of receptors is important and the loading with cytostatics it is not necessary. So, using the presented methodology, core shell structures can be obtained. The core is magnetite and it is coated with silver or gold nanoparticles via the intermediate cysteine shell. As it can see in these images, the silver or gold nanoparticles can be continuous as we tried to represent in image A, or it can be just an insular disposal of these nanoparticles on the surface of the magnetic core as we tried to illustrate in image B, while images C and D represent the smart magnetic drug delivery systems loaded with cytostatics. On behalf of the authors, we are acknowledging the financial support from the Romanian government and certainly Thank you very much for your kind attention.